Hi everyone, I want to talk about seizures treatment. So this is going to cover the general pattern when it comes to seizures disorder treatment. Okay, let's go. When to start? Now someone is saying, you asking me? No, okay, I'm asking myself. When to start anti-epileptic drugs? The first thing is we have to confirm that event is actually a seizure disorder. If I've gone through my presentation on differential diagnosis and causes of seizures, and even at the beginning, that is general info on seizure disorders, you will understand what I meant. Then the next thing is how stable is this patient? And of course, do we have the possibility of recurrence here? After you've asked and answered yourself those previous questions, then you ask yourself again, is this individual severely ill? So if this person is severely ill, then you use intravenous phenytoin or fosphenytoin or levetiracetam intravenously. You may give anti-seizures for a very short time and correct the metabolic derangement if this is secondary to metabolic derangement. And you need this anti-seizure medication right now, but for a short time till you're able to correct this. That is if it's a condition that you cannot correct instantly. But if it is a condition you can correct instantly, there's no need placing this individual on long-term medication. The first question to ask ourselves, that is the service providers, is this the first time that this individual will be having seizures and any return to baseline immediately? If that is the case, which means this is the first time an individual returns to baseline immediately, then do EEG. And you also check for remote symptomatic causes like brain tumor, CNS infection, intellectual disability, or seizures during sleep. So that will take us through history, physical examinations, and tests that could help to identify the cause or causes. If that is done and recurrent factor or factors is or are identified, then you start anti-epileptic drug immediately. If not the case, then you can wait for possible second unprovoked seizures before starting the individual on anti-epileptic drugs. If this is first seizures, but it is prolonged and post-ictal state is also prolonged, or the individual is not having complete recovery, or there is injury secondary to this seizure episode, even though it's the first seizure but there is injury, or there is severe acute seizure attack, please start anti-epileptic drugs. Okay, you can discharge if the individual returns to baseline quickly with follow-up and full counseling and necessary investigations. You can refer if this is the first time seizures, but you want appropriate diagnosis to be made, particularly all unprovoked seizures. Referred to neurologists also so that the neurologist will be able to go over the radio imaging results and nitty-gritty of anti-epileptic drugs. If it is provoked, there's no need to refer. All you need to do is treat the cause that provoked it. The education that must be given to all affected individuals will be letting one know that the following will change. 1. Driving. It's going to be suspension of driving. That is a difficult terrain. A lot of patients will put up a fight. Okay, but you do it wisely and with empathy, and depending on the rules and regulations under the jurisdiction where you're working. Independency will be lost. So this is the individual that will not be self-dependent for 24 hours every day again. Employment may be affected in such a way because the type of job the individual is doing might have to be adjusted. Insurance policy will be affected, and of course, a lot of empathy should be shown because there will be self-esteem problem. The individual could become depressed, and we need to counsel appropriately, particularly against suicide and suicidal ideation. Anti-epileptic drug side effects must be explained in details, including the minor and major possible side effects. This person cannot be swimming alone again. Okay, why swimming not alone? Bathing should not be the bathtub, bed, showers, because individual could go into seizures while in the bathtub and the hot part of the water is turned on and just be burned severely. Don't lock the door behind you while you are in the washroom or bedroom, depending on where you are on the surface of the head, whatever name you give to it, or giant or whatever. Don't bathe babies. Okay, and a woman will tell me, but I'm a mother. Well, that is an advice. Probably you contact the social worker in your region, and your doctor will be able to help you to make that link, and will be able to help you on how to salvage the situation at hand. Set time on your stove so that you don't keep burning your foods and probably burn down the house and burn yourself as well. No more heavy machinery operation. This is not an individual that will operate forklift or climbing up 3-4-story buildings or mounting Kilimanjaro or Mount Everest. Watch out for suicide ideations. Just make sure a good rapport is developed with the affected individual so that they can confide in you once they're having those suicidal ideations, because that may lead to suicide or frank suicide. Okay, with that, I've come to the end of how we'll start picking medications for anyone with seizure disorder. So it's not everyone who has convulsion that will start anti-epileptic drugs. So the next will be selection of the appropriate anti-epileptic drugs. Kindly subscribe to my channel so that you can get my presentations immediately they are published. Thank you.